Okay, let's finish this discussion or this video about anxiety disorders and others with trauma and stress related disorders. Remember, these are not under the umbrella of anxiety disorders. They are their own category. So the first and most common, or most well-known, I should say, is post-traumatic stress disorder, or PTSD. This is characterized by 4 or more weeks of the following symptoms: haunting memories, nightmares or flashbacks of the traumatic event, social withdrawal, jumping anxiety, where if they hear a sound, they're jumping, and sleep problems. Only about 10% of women and 20% of men actually react to a traumatic event and develop PTSD. So this tells us that most people are actually resilient to developing PTSD. Holocaust survivors have shown a remarkable resilience against traumatic situations, not just the Holocaust. So what is this telling us? Is this telling us that people who have been through multiple traumatic situations have learned or gained this resilience in order to not develop PTSD? We're not really sure. However, all major religions around the world suggest that if you survive a trauma, it actually leads to individual growth. The next disorder is acute stress disorder. It's very similar to PTSD, however, it's shorter and it starts immediately after the traumatic event rather than appearing a little bit later on. So it's a little bit shorter, that's why we call it acute. Think math, acute angles are smaller than 90 degrees, right? So these are shorter. It can last anywhere from 3 days to a month. And that would be acute stress disorder, but they have similar characteristics. Both acute stress disorder and PTSD were once considered anxiety disorders. However, they are no longer considered that because not all patients experience anxiety. So how can we put it under that category when they're not even experiencing anxiety? Sometimes patients are experiencing anger or aggression or dissociation from reality. And other things. So we can't really put them under the anxiety umbrella when not all patients are going to be developing anxiety. So how does anxiety come about? Well, if we look at it from the learning perspective, this is, remember, the behavioral perspective, they would suggest that fear conditioning leads to anxiety. Over time, we have learned and been reinforced to be afraid or fearful or worrisome of a particular object, and then we generalize that fear, and now we have anxiety over everything. Fear responses, investigators believe, are instilled through observational learning. So we see someone else be afraid or worried or stressed or anxious, and then we also are afraid. Okay, so young monkeys develop fear when they watch other monkeys fear snakes. So, I mean, it just makes sense. The biological perspective says that generalized anxiety, panic attacks, and even OCDs is linked with brain circuits like the anterior cingulate cortex. And this is right here in our brain here. And this part of our brain is used to regulate our blood pressure and our heart rate. It's also involved in higher level functioning such as our attention, as well as our reward anticipation and our decision making, and then our impulse control as well. So you can see why that particular brain structure would be an important part of these disorders.